Hi everyone, welcome to another episode of Psych Talk. Today I will talk about Adlerian Therapy by Alfred Adler. So, Adlerian Therapy aims to help clients shift their perspectives and recognize how their views of the world may be flawed or faulty, and it's contributing to their maladaptive behavior. An example of this will be a client thinking that if they don't please everyone around them, they will be rejected and not loved. And basically, this belief often originates in childhood, particularly for individuals who grow up in environments where they feel their worth is conditional upon others' approval. So, for example, a child may have experienced constant criticism or high expectations from parents, leading them to believe that their values lies in their ability to please others. And they also may have seen siblings receive more attention when they complied with parental demands or acted in a way that aligned with family expectations. Also, the Adlerian therapy is kind of a holistic and goal-oriented approach that emphasizes the individual's striving for significance within social contexts. So basically, the heart of these theories is the notion that humans are motivated by a desire to belong and contribute to their communities. Also, Alfred Adler talks about the importance of birth order, which suggests that a child's position in the family significantly influences personality development and also contributes to shaping the individual worldviews. So he identified specific characteristics for firstborns, middle children, and lastborns, and only children. So for the firstborns, basically they are often positioned as the responsible child. They may develop leadership skills, a sense of responsibility, and a tendency toward achievement. Because they initially had undivided attention from their parents, because obviously it was only them, they can also be more sensitive to feelings of displacement when a sibling is born. And as a result, they may become more authoritarian and striving to regain their position of dominance. They often display high levels of conscientiousness, but may also struggle with perfectionism or fear of failure. The middle children, they're often caught between the overachieving firstborn and the youngest. Middle children may feel overlooked or neglected. They tend to develop strong negotiation skills and often playing the role of peacemaker within the family. Middle children may seek also social validation outside the family and are generally considered adaptable and independent. However, they may struggle with feelings of inferiority or lack of a clear identity. The youngest children, so it's typically the baby of the family, and the youngest children may receive a lot of attention and indulgence, which can result in a carefree and dependent nature. They often develop a strong social skills, using charm to gain approval, but may also have a rebellious type of personality, and they strive to break free from family expectations. And sometimes the younger child may develop this type of skill or this type of personality that is very different from everybody in the family. So it's kind of seen as unique. So this child may be maybe the more successful one, or just orienting itself to a different career or way of living. The only child. So growing up without siblings, only children often experience obviously a lot of attention from their parents, which can lead to traits of maturity and self-sufficiency. Although they can be very spoiled and it's hard for them to share with their peers or even relate to their peers. Although they're typically very comfortable around adults and may display higher levels of confidence. However, they may also experience difficulty in general with perfectionism or peer relationships, and it's because they are accustomed usually to being the center of attention. One of Adler's unique techniques is the analysis of early recollections, which basically involves asking clients to recall specific childhood memories and interpreting this recollection as a lens through which they view the world. So all of us, obviously, we don't remember much about our childhood. Maybe when we were, 4, 5, or 6, we don't remember much, but we do have these vivid memories. And so that's what the Adlerian therapy focus on. It focuses on basically analyzing these early recollections. And basically, Adler believed that these memories, whether they are consciously significant or not, reveal a person's current life themes and sense of self. And through the analysis of these early memories, basically we can uncover in the client core beliefs about themselves, others, and life challenges as well. So an example of early recollection in therapy would be, so for example, let's say we have a client named, Sarah, who recalls a vivid memory from when she was 6 years old. She may say, I remember playing on the playground and seeing all the other kids running around laughing. I wanted to join them, but when I approached, they ignored me, and I stood by myself pretending I didn't care. But I felt really sad. In an Adlerian therapy session, the therapist will explore this early recollection with her, looking for patterns or themes related to belonging and social interaction. And her memory suggests that she may have internalized the belief that she's excluded or unimportant in social situations. And so the therapist might ask her how this memory resonates with her current relationships, prompting her to reflect on whether she still feels disconnected or overlooked in her adult life. And so through the therapeutic process, the therapist will work with Sarah to challenge these long-held beliefs and explore new ways of interpreting social situations. And the goal is to help Sarah see that while she might have felt excluded as a child, this does not define her current self-worth or capacity to form meaningful connections. Adlerian therapists use also different techniques to foster change and self-awareness in clients, with a strong emphasis on motivation modification over behavior change. And for example, we have this push button technique. So this technique helps clients to regain a sense of control over their emotions by visualizing different emotional states as buttons they can push at will. So for example, a client may be asked to visualize their depression button and a happy button, and recognizing that they can actively choose which button to press in response to life events. And this technique can be especially powerful for clients who feel overwhelmed by negative emotions. Also, one thing that I didn't mention before that I want to mention now is that basically Adlerian therapy makes us understand that all of us have really different perspectives of the world and the people that surround us and everything else based on how we were raised, who we had as friends when we were little, or based on our environment. And there are some world views that can be very maladaptive to certain individuals, and that is the core of Adlerian therapy, is modifying these world views, right? And as therapists, we have to really understand the perspective of the client and try to shift. I actually forgot what I was saying because I got interrupted, so I don't know what the fuck I was saying. Okay, I'm gonna just keep going with practical techniques in Adlerian therapy. So I talked about the push button technique, and now I'm gonna talk about the immediacy and confrontation. So Adlerian therapists often engage clients in the present moment, using confrontation when necessary to address discrepancies between what the client says and the underlying beliefs. And this fosters direct engagement with the client's lived experiences and private logic, and encourages change. There is also the acting as if technique. So the client are encouraged to act as if they are already the person they wish to become. And this technique can help the individual break out of old behavioral patterns and experiment with the new ways of interacting with the world, promoting psychological flexibility and growth. And then we have the lifestyle assessment, which is a core component of Adlerian Therapy. And basically, the therapist gathers comprehensive information about the client's family dynamics, early memories, and private logic. And basically, this helps to create a roadmap for the therapeutic process and allows the therapist to understand the client's guiding principles and how they approach life's challenges. And so, in conclusion, basically, clients learn to identify their faulty views that may be contributing to their maladaptive behavior. And so, we can try to change the way they view the world and replace those maladaptive behavior with an appropriate behavior. And also the Adlerian Therapy, it's about encouraging authentic relationships and empowering individuals to take control over their lives. And so I kind of want to give you maybe a self-reflection exercise if you want to consider it. So think about the perspectives that shape your reality. Are there beliefs you hold that might be holding you back? And what steps can you take to reframe those thoughts and align more closely with the life you want to lead? And so just think about it. And that's it for this episode. I hope you enjoyed this therapy technique. And I'll see you on another episode.